In the last week, Arizona has seen more than 10,000 new cases of COVID-19 added to our state total numbers of infections. More than 3,000 of those reported just today, and 17 more Arizonans have lost their lives due to complications of COVID. 6,257 Arizonans in all have died in this pandemic because of it. And our weekly average positivity rate is back at 10%, which is the highest we've seen since July. So joining us now is Dr. Cara Christ with the Arizona Department of Health Services. Dr. Christ, obviously we know that these numbers are upsetting to you, certainly upsetting to digest for everybody right now. 10% positivity rate, we hoped we wouldn't get back there. What needs to change?
So we are concerned with the increasing numbers and especially the percent positivity because that indicates that there's increased transmission in the community. We really need everyone to not let their guard down and make sure that they are wearing masks when they are out in public. Wearing masks if you are in your home or somebody else's home with people you don't live with, and to make sure that you're physically distancing, staying 6 feet away from others that you don't live with.
We are about 2 weeks after Halloween. Obviously, people gathered. Maybe many tried to follow suggestions of getting together outdoors. But clearly, we see about 2 weeks later, after any major gathering event, an increase. That R0 number that you guys talk about is critically important, is above 1 again. So what is your advice? Are we looking at potentially any kind of mandate or clear directive as we approach Thanksgiving and the holidays beyond?
So we're encouraging everybody to think about how they're going to celebrate Thanksgiving this year. It's likely going to look very different. And so you're going to want to limit households that come together. You're going to want to wear masks if you do bring households together, and really try to protect those loved ones who may be more vulnerable by celebrating virtually.
Throughout this, you and the governor have encouraged a number of things, encouraged wearing masks, encouraged the social distancing, but these things have not been mandated, at least on a statewide level. Clearly, the numbers are showing that Arizonans are not motivated enough by just encouragement to do the right thing or take action regarding COVID. So all these months in, is it time to look at a different strategy?
So all options are still available on the table, and we are looking at, as counties start to move back into substantial transmission, based on the benchmarks, we'll be working with our local county health departments to determine what is best for that community, but we haven't taken anything off the table.
Maricopa County, obviously the most population dense area, so numbers there are very disturbing, or here I should say. Coconino County, though, also some troubling statistics. What are you observing there, and what can be done?
So statewide, we are seeing increased rates across all counties and increased percent positivity across most counties. And so really, even though Maricopa County and Pima County have a countywide mask mandate, we still need people to understand that they are safer at home, that the more you go out and interact with people who are not from your own household, the higher your risk is for getting COVID-19.
Hospital capacity at 88% on these last figures, as I understand. So are you concerned specifically about that, potentially canceling elective surgeries like we did earlier in the spring? I know previously we had help coming in from nurses and doctors from other states while we were sort of surging and they had waned. Is that still happening now? Are we going to be in a crisis in our hospitals?
So we're continuing to watch the hospital metrics. We've been between 80 and 88% capacity. About 13% of those are due to COVID on average over the last week. So we continue to watch what proportion our COVID patients are playing a role in our hospital capacity. But as that creeps up, we will be working with our hospitals to identify what needs they have. Is it additional staffing? Do they need additional resources? And we've been in constant communication with our hospitals. We are hoping to look at some type of bringing in additional staff, whether that's volunteers, whether that's staffing from other states. But every state is going through the same thing we are right now.
College students may be traveling home for the holidays, then coming back to Arizona, vice versa. What is your warning about holiday travel specifically? And also, what are you considering regarding the schools? It's now going district by district, many deciding to go back to virtual learning, and then the district next door will be on campus. So again, you're leaving Arizona families kind of in this state of, so much uncertainty.
So what we would encourage, especially with the holidays, we are concerned that those holiday gatherings are going to increase the numbers even more. So to make sure that you are, limiting the number of households that come together, requiring masks, and taking the celebration outdoors so that you can get better ventilation and physically distance. For our schools, we encourage, there are so many things that schools provide to our students. We encourage that students stay in person. What we would encourage is to limit the after-school extracurricular or sports activities, and understand that even when you're with people outside of your household, even if they're friends, that you need to wear a mask and physically distance, because a lot of people don't even exhibit symptoms from COVID-19.
All right, Dr. Cara Christ, Arizona Department of Health Services, thanks so much for your time. The best to you.